Okay, guys, it's Dr. Sexton from San Diego, and today I'm going to talk to you about the role of therapy in treating your depression or your anxiety. You know, I see patients, again, all the time that come to me to talk to me about problems with depression or anxiety, wanting to get medications, wanting to get some kind of solution. And the frequency that people tell me that they are not going to get anything from therapy, that they've either been to therapy before and it didn't do anything, or that they know everything that they need to know about themselves and this just isn't going to do it. They need some real medicine, this is a real problem, or this is real stress, and they are not going to get something out of their therapy. And they just want me to help them immediately with this. And so in those circumstances, I obviously try to deal with their personal issue, but I then explain to them, look, there may be some reasons why you haven't received benefits out of the therapy beyond just not being a problem that can be fixed by therapy. Maybe it was the way that you were approaching the therapy. Maybe it was how the therapist approached you. But I want to try and increase the likelihood that we can get the best results out of all of those kinds of things. And so I wanted to touch on the role that I think therapy can play in dealing with all of these things. First, if people have depression or anxiety, yes, I understand that that is a chemical problem, an electrical problem, a physiological problem, something that needs some real attention in there. But that problem has been present for many, many years, and it has contributed to the habits which they have developed. And some of those thinking habits that they have in terms of how they approach stressful situations, in terms of how they approach problems, in terms of how they view themselves, those kinds of things have been affected by that chemistry for the years, and we're not only going to have to overcome the chemistry, but we're going to have to overcome the habits, because many of these things are not going to be automatic to feel like, wow, I'm amazing. This is going to be something that we have to work on, and so helping you to change your view of yourself, to change your view of the problems that you have and that you have to overcome. Those are going to be some of the things that we need to do. And unfortunately, it's not as simple as simply having your partner or someone who knows you pretty well to tell you, hey, I know that you can do this. It's going to take a little bit more than that. So I want to encourage you, look into seeing a therapist for your problems so that you can talk through these kinds of things. And again, try and change your way of thinking about things. I ask patients who've been seeing therapists for years, so what kinds of things have you learned from your therapist? Often I'll get looks like, oh, are you nuts? I said I was going to a therapist, not to algebra class. And I say, no, this is important because we're not just going to therapists so that you can tell them what kinds of things stressed you out last week. That's just paying someone to be your best friend and petting your hair. What you really should be doing is trying to go there and, yes, of course, tell them the kinds of things that have been stressing you out. That's going to give them a lot of insight. But then you want to say, let's take a look at this constructively and make sure that you are looking at, okay, what am I going to personally do in the next week, in the coming weeks, so that I don't fall victim to these kinds of problems again in the future. Being proactive and constructive to try and change who it is that you are. Remember, that's why it is that we're going to therapy, to try and improve who you are, not just to make it so that every jerk around you starts being nicer to you. Those kinds of therapists don't exist, I'm afraid. So knowing that we are going to the therapist, trying to learn things and trying to overcome these problems can be the foundation for which we then go through our therapy and go through the rest of the kind of treatment that we're dealing with in terms of depression or anxiety. Before you ever go to see a therapist, if you don't already have one, I want to give you an assignment that can be a good foundation for this. I call it the list of 10 thinking habits. And what I tell patients to do is, let me give you a referral to a therapist. Hopefully we can find one that accepts your insurance. But before you ever go there, I would like you to sit down by yourself and write down a list of 10 thinking habits that if you were to have a relationship with a therapist for a year, that you'd like to see improved about yourself. Maybe you would like to have more motivation. Maybe you would like to have a little bit more resiliency whenever someone says something personal to you. Maybe you don't feel like you should take things so personally. Figuring out these kinds of things. Maybe you don't want to be so self-critical. Figuring out the kinds of things that cause you to feel worse about yourself rather than better about yourself. those are the kinds of thinking habits that we want to try and find a connection between and see if we can get rid of the negative ones and really, really reinforce the positive ones. In addition to writing down the 10 thinking habits that you would like to see improved about yourself, get someone who knows you really well, maybe your partner, maybe a sibling, maybe your parent. Find someone who knows you really well, and separate from you, they should write a list of 5 thinking habits that they think you should want. Not the ones that they want you to improve. I don't want you to try and do the laundry a little bit more often. But if they can find a way to look at your problems a little bit differently than you do, and you guys get together and discuss those, communicate with each other what those 5 and 10 problems are, and your partner may have a little bit different insight. I had one patient that told their partner they wish they didn't hate work so much. And the partner said, I can't believe that you said that. You're one of the hardest working people that I know. But come to think of it, the only time you dislike work is when you have a disagreement with your boss. And they came down to the understanding that any time that the patient's hands were tied and they felt like they couldn't achieve a perfect result, that made them feel more insecure and more uncomfortable. And they were much more unhappy under those circumstances. So after looking at these kinds of things, they were able to sort out what was the real problem and what was the perceived problem. And so then if you were to take both the 5 and 10 lists into every single therapy session that you have, your goal is going to be, yes, of course, to talk about the things that have stressed you out for the past week. That's fine. But I would save the last 15 minutes of your therapy session so that you can say, okay, whoa. Let me see what kinds of things I contributed to this problem myself, so that if I encounter the same kinds of issues in the weeks to come, I know what I can do about it a little bit differently and maybe not suffer these consequences of the depression and the anxiety like I have in years past. We're going to overcome this. I know we can.